I have been asked by a lot of medical students that I am interested in artificial intelligence and machine learning. Can you please guide us how to go about it? So I thought, let me make a definitive video because this kind of information is not easily available, and I personally would have loved it if something like this was available during my transition journey. So I'm creating this video for all the medical students or young doctors who want to learn about health tech and possibly make a transition to this field. But before we begin, I want to establish my credentials on this subject. I am Dr. Sandeep Kumar. I have completed MBBS from AIIMS Pune in 2015, and then I served the Indian Army as a medical doctor for 7 years. After completing my short service commission, I cleared the engineering exam called GATE and then got offers from IIT Bombay, IIT Delhi, and IIT Hyderabad. Finally, I joined IIT Delhi and did my MTech in Biomedical Engineering with a focus on artificial intelligence in medical imaging. After completing my MTech, I joined Inference Inc., also known as Google of Biomedicine, where I'm currently working as lead clinical scientist. Now that you know my background, let's get into the details of today's topic. The motivation. So when you are in medical school or in medical practice, you will come across problems and you think, why can't we solve it? You can look at some instrument and think, can we make it more affordable? Or you can look at a procedure and then think about a better way to do it. Or maybe come across diseases which are simply unsolvable or untreatable. Or you can see patients and then get emotionally moved by the problems that they are facing. Or it could be just that you had maths in your 12th standard and you enjoy reading and understanding the technical aspects of medical tools and devices. Any of these can be a motivation for exploring the health tech domain, and it is really important to have a core motivation to follow this path. So we have problems in healthcare and you want to solve it. To solve these problems, there are 5 major engineering approaches that you can take, with each having their own field of study. The first one being computational. This field includes artificial intelligence, machine learning, computer programming, medical imaging, data science, Gen AI, and all the buzzwords that you hear today. You can solve a lot of problems with computational methods, but not all the problems. The second field is biomechanics. Using mechanical principles and tools, you can design and develop equipments, instruments, prostheses, and mechanical devices. The third field is biomaterials. Here you can create materials which have very special property and which allows you to do something which your body cannot do, either because of a disease or because of the limitations of human physiology. The fourth one is bioelectronics, where you can create electronic equipments which allow you to do a lot of sensing or therapeutic stuff. For example, ECGs, or maybe TENS devices. And the fifth one is biotechnology, where you use the principles of biotech to create biological substances which will be either therapeutic or diagnostic in nature. So these are the 5 main areas which you can take towards solving a problem, and all of these fields are quite different from each other. The skills which you obtain in one field are not easily translatable to other fields or other domains. There can be products or solutions which can use principles from different combinations of these fields, but they will typically require a domain expert for each of those domains. So before joining IIT Delhi, I was interested in ideas from all domains, ranging from nanotechnology, AI, medical devices, and whatnot. But after taking courses and doing lab work for 2 semesters, I realized that AI and ML is what interests me. And so for the second year, I chose a project which was based on using AI ML techniques. So don't worry if you're not yet sure which domain is your real calling. Outcomes. So whatever domain you choose, you mostly end up with these 4 outcomes. The first one is to become a hobbyist, which is mostly a stepping stone for all the other outcomes. Here you learn technology or problem-solving skills just for the fun of it, or to get a feel of it. It is a very important step because this is where you start getting your hands dirty and you will realize if this is your cup of tea or not. It is possible that you might be overwhelmed by the rigors of the field, and that's perfectly fine. You will learn 2 things regardless. First, do you enjoy learning technical stuff? And secondly, the amount of effort required in engineering a product or a solution. And both of these learnings will be useful even if you choose the non-technical route or continue back into clinical practice and pursue it as a hobby. while doing your clinical practice as your main focus. After the hobbyist step, you can continue to be in this stage, but if you really like it, you can consider going a step ahead and doing it seriously. So these are the other three major options after this step. Academia. A lot of students take this route where they follow this path of being a full-time professor and researcher at research institutions. Academia offers much more freedom to pursue your research independently, and you would contribute a lot to the scientific society and bring innovative solutions or fill knowledge gaps which will improve patient lives directly or indirectly. Industry jobs. You can also choose to go for jobs in the industry, and this is a very lucrative path. Job opportunities can include roles like clinical scientist, clinical data curator, product manager, product owners, clinical application specialist, medical advisor, manager, or even director level roles, depending upon your skills, degrees, and experience. The next is entrepreneur. This is one of the riskiest but highly rewarding paths which a lot of people take. If you are somebody who is interested in creating products which touch the lives of millions of people, this path makes a lot of sense. If you enjoy entrepreneurship or have a solution to a problem which people are willing to pay you to solve, then this is the path that you should take. A lot of doctors have already taken this path and are making waves in the field of health tech. So a good thing about these roles is that you can switch between them depending upon your motivations and goals in your life. For example, you can switch from academia to industry jobs, entrepreneurship, and so on. Navigation. So basically, you are at this level. You are an MBBS doctor, maybe MDMS, and you are looking to reach here, which is either of the four major outcomes that we discussed. What are the things that would take you from here to here? Knowledge, skills, experience, certification, or degrees. The fourth one might or might not help if you have the first two or the first three from this list. So knowledge, skills, and experience are more important, whereas certifications and degrees are optional, but they might help in certain circumstances. In the next part of the video, I'm going to talk about how to gain knowledge, skills, and experience to make yourself ready for challenges in health tech. If you have any specific question, feel free to ask here. I will try and reply to your queries.